3, 4, 5, 6.
Thanks, Jeff Mark.
We need one more. Megan, he'll be right back. Okay, with that, we do have 7 members in the room, and I'm going to certify the closed meeting. In order to comply with Section 2.2, 3712D of the Code of Virginia, it's necessary for the board to certify that since the Fairfax County School Board convened a closed meeting on November 14th, 2019, to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements and only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered by the board during the closed meeting. Do I have a motion? Motion made by Ms. Schultz, seconded by Ms. Evans. All those in favor? That motion carries with Ms. Keys-Gamarra, Mr. McElveen, and Ms. Derenak-Kofax, and Mr. Wilson out of the room. We will now continue on with tonight's work session, and I apologize to audience members that we are starting quite a bit late. We will start with our strategic plan goal to caring culture report. And so I take it that Mr. Duran is going to be leading this session. Am I correct? Or Dr. Duran, I apologize.
So this evening we have some staff here that I'd like to have them introduce themselves in a moment. Tonight we're going to provide a few of the key highlights from the presentation that was already provided to the board. And then there were several questions that were asked at the presentation that we will also provide an overview of those answers to those questions that's also been posted. So Ms. Waltz, if you'll start.
Kathleen Waltz, Executive Director, Professional Learning and Family Engagement.
Lady Hrida, Director of Research and Strategic Improvement.
Deb Scott, Director of Intervention and Prevention Services.
And Teresa Johnson will now begin by again giving the highlights and then walking the board through some of the questions that were asked at the board meeting presentation.
So good evening. We presented a summary of the Caring Culture Report on October 24th, and I just wanted to summarize a few of the high points for you this evening. Some of the areas that we made progress in for welcoming environment included students and families feeling respected and included in schools, a decrease in referrals for students identified as Black, and an increase in students who report being drug and alcohol free. We also exceeded the target for the % of employees who utilize the Employee Assistance Program. We also reported on some areas that we know we need to continue to focus on, and these areas include decreasing student referrals for disruptive behavior at the elementary and middle school levels, continuing to provide resources to students to increase their self-determination and their ability to make choices that will contribute to their emotional well-being and balance, and we want to help students increase their healthy life choices. So I am going to shift now to review a couple of the responses from the preliminary questions that were asked during the school board presentation on October 24th. And these responses are all posted for you on board docs for this evening. I'm going to start with question 11. Question 11 was asked, the topic was sleep and what's preventing students from getting sleep. Also asked what our statistics were by grade from the youth survey and what some of the trends are. There also were some questions about the data and what the data meant, and I also, Ms. Hrida could jump in here if I need additional information. So taking a look at the response to this question, as far as the metrics were concerned, the business rules for the strategic plan metrics and the youth survey report were different. The strategic plan metrics use the total number of students who took the survey as a consistent denominator in the calculating percentage. The youth survey report allows for variation by item. So if a student took the survey but did not respond to the sleep item, the strategic plan metric would treat the non-response as not getting 8 hours of sleep or more, while the youth survey would report, the youth survey would have removed the student from the calculation of the percentage entirely. So the following table, if we could scroll down a little bit, Angela, the following table represents the youth survey data from 2013 forward regarding sleep and homework. So we combined several of the questions that were asked about sleep and homework. The percent of students reporting 3 or more hours of homework has decreased at each grade level, and the percent of students reporting 8 or more hours of sleep has decreased at grade 8 by approximately 10 percentage points and fluctuated within about 2 percentage points up or down for grades 10 through 12. So I just wanted to leave this up here for a minute, and so you could see where the decreasing trends are across the years. So that is, again, this information is available to you in onboard docs. So if you'd like to pull that up, it certainly could give you some interesting information related to the homework and students that are getting 8 or more hours of sleep on a school night, as reported by students. It was interesting to review. So I don't want to spend a whole lot of time, but I just wanted to make sure that we glanced at this chart because there were 2 other questions I wanted to focus on just for the purposes of our conversation before opening it up to questions. So taking a look at question number 9, that addresses vaping. This was a question that came up on October 24th as well. So while information is going to be shared with board members in an upcoming Brand briefing, possibly tomorrow, I'd like to add some additional information about what we're doing in collaboration with other organizations. As you are aware, we've added in several reports to the Brand briefing. We do have 2 public vaping websites, one for students and another one for parents. And all of this contains information about vaping and the health ramifications and the supports that we have available. Our substance abuse prevention specialists have been assigned to each pyramid this year. They're available to work with students individually or in small groups. They push into some classes to provide supplementary activities around alcohol and other drugs, which also includes vaping. They provide alcohol and other drug education, counseling, interventions, and referrals to the Community Services Board for those students who have greater needs than the school can meet, where we do a warm handoff. They also provide educational presentations to students, parents, and community members. Also, if you've been following along the FCC PTA newsletters, we appreciate the collaboration that we have with the FCC PTA, and they are urging PTAs to host vaping sessions for parents, featuring either the FCPS substance abuse prevention specialist for their pyramid or one of the public health nurse education team members. They have a kit, they've created a kit. We've worked with them to build bigger crowds for these forums and really following up. Their plan is to follow up with each PTA to find out how they plan to host the sessions. We have links together across each of our websites. In addition, the Fairfax County Health Department's public nurses, along with technical assistance from the Tobacco Control Program, launched the first Virginia pilot of Catch My Breath. The program was received by 6 classes of 6th graders at Kings Glen Elementary School, and they are collecting pre- and post data through the duration of the program that's currently being analyzed. So with that, I'd like to skip down to question 6, or up to question 6, if we could. And last, before I move on, I would like to share some additional information about behavior intervention teachers that was requested. First, I'd like to say on behalf of the schools and special services, thank you for funding the additional positions. Now that we have a behavior intervention teacher supporting every pyramid, I have principals and other administrators reporting how much this has made a difference to them and how more frequently they see their behavior intervention teacher in their buildings. Our data shows since August 2019, these additional positions have resulted in 114 school-based trainings from Behavior Intervention Services. We've had 84 district and regional trainings. We've supported over 3,700 hours of supports to schools and to students, and about a third of those supports have been to students in the general ed population. Over 2,000 FCPS staff members have been trained in various programs, excuse me, and trainings, such as building positive relationships, crisis and conflict cycle, MANT, one of our crisis intervention programs, executive functioning skills, proactive behavior approaches, a focus on Tier 1 behavior interventions for schools, and disengaging from power struggles. And that is just to name a few of the many trainings that they've been offering. So I just want to say thank you very much for those additional positions. So with that, I'm going to open it up for questions, or Mr. Wilson.
Thank you, Ms. Johnson. I appreciate the answering of the questions, and if folks have additional parts of her presentation that you'd like for her to go into more detail now, as opposed to, I think we did a very abbreviated presentation tonight because we received her presentation earlier. But if board members feel like they need a longer presentation, we can go back and click through slides. I don't think we need that because we've already done it, but if there's board members who feel that way, let me know. Okay. And so before I start questions, I did want to recognize that we have one of the board members-elect, Melanie Marin, is here with us tonight. And colleagues, I'm going to observe our 3-minute rule here tonight, even though we were only in closed session for a couple of hours. As one board member, it felt like 4. So let's try to keep our questions limited and non-repetitive if we can. So if you would like to ask questions, please give me your give me a wave. I have so far Sandy Evans and Elizabeth Schultz, so I'll begin with Sandy.
Thank you very much for the presentation. You did an excellent job both the other night and tonight. I do want to first start with the sleep data on page 6. Thank you for bringing that to us. I did want to make the point, 2015 is when we made the change, and you can see the dramatic impact that later start times had on teen sleep. If you look at the 10th grade, going from 22% getting 8 hours of sleep or more to 28%, that is huge in 1 year. Now, it kind of went up and down a little bit, but it's still at 27%. 12th grade went from 14% to 17% in 1 year, and then again, kind of up and down, but stabilizing at 17%. We still want it to be a lot better than that. That's not good enough by any means, but it does show the impact of later high school start time. So unfortunately, at the 8th grade level, you see where we went earlier for middle school, and sleep declined from 50% to 48% in that time. So that is the dramatic change between 2014 when we had the earliest start times for high school, and then 2015 where we went later. So I do think, I understand your explanation about the differences between the youth survey and the strategic governance metrics, but to my mind, it doesn't make sense to have a metric that says if there was a non-responsive answer, you assume something about that non-responsive answer. I'm not sure why we do that. So I would ask that you look at that again. Why do we assume one thing or another, that you aren't getting 8 hours of sleep? It just, that's kind of inconsistent. I would think we would take a look at what's in the youth survey and say we really need to get those numbers up at all levels, 8th, 10th, 12th grade. So that would be my one comment about that. And I do think that just for well, I've said what I have to say about that. I also wanted to raise another issue, which I think all of the board members have received some advocacy from. I mentioned this the other night when we were talking about student success, advocacy about both a task force on anti-racist bias in our curriculum, as well as advocacy on Indigenous Peoples Day. And I want to recognize that we have advocates in the audience. Thank you so much for joining us tonight to listen to our conversation about caring culture. So I did just want to raise that as an issue for the board to be considering and be cognizant that this is something that I will want to be looking at and addressing. And I've got 7 seconds, so I can't say much more about this at this point, but so please, Mr. Wilson, put me back on go back. Thank you.
Thank you, Ms. Evans. Ms. Schultz?
So what's the N? I don't know that, I have no idea what that data means, because it could be 48.2%, and you could have had half the respondents that you had in 2015, so I don't have any understanding of how many students responded, what the student population is. So 48.2% of what? I don't know. We're right back to data in context, meaningful data in context. And so I don't know what to take away from this, because this is a response to a question that several of us had, and how many students are taking the youth survey, how many are opting out, of those that are participating, is it the same number each time? These are critical things for staff to understand, this board needs to be able to understand, because that table doesn't actually tell us a lot. I also actually find it, I have the opposite reaction of Ms. Evans. I find it stunning that from 2013, for example, to 2018, we have a 0.5% increase in the number of students who are getting 8 or more hours of sleep in 12th grade. That's negligible to be almost insignificant, depending upon what the N is. Again, I'm caveating everything. So I want to talk a lot about this slide because it potentially is informative, but I don't understand what's behind it. I got to tell you, Dr. Brabrand, I'm a little disappointed that on page five of these answers, how are we addressing vaping updates? An update is being provided in the November 15th Brabrand briefing. That's tomorrow. You couldn't have provided that tonight? Like, wait till tomorrow, it'll be in an email is not particularly helpful when we're all together. That's kind of crucial, especially since there's been the first double lung transplant for a vaping injury. Ms. McLaughlin and I addressed this yesterday at a student town hall, another student town hall that I had. That's all I have for right now. I'm probably going to go on a go back.
If I could, on the vaping, we've actually done several updates to the board around vaping over the last year, with multiple things that we've done based on board feedback. And, as always, it's managing workload and getting the work done for these work sessions for the formal school board presentations. I don't know the particulars about why today versus tomorrow, but we've done many updates, and we're going to provide an additional update in the Brabrand briefing, and if that doesn't suffice, let me know, and we'll work on it.
If it's going to be in a Brabrand briefing tomorrow, you already have the information. I mean, if there's enough to put into an update tomorrow, there's enough to tell us tonight.
Well, I will just say, I haven't seen it. Maybe it is available, and if staff has it, but to be honest, our folks work all night, in the morning, over the weekends to try to get a lot of this stuff ready, and sometimes, to be honest, the Brabrand briefing, many of you know, have pushed me to try to make it earlier on Friday. Sometimes it goes out late because we're still getting up at the crack of dawn, crunching stuff, and
Thank you, Dr.
hope that's
Brabrand.
helpful.
Let's go to Megan McLaughlin.
Thank you. I do look forward to hearing from my colleagues a little bit more about what they see this report has in it. I think, Dr. Brabrand, from our Tuesday work session all day, this is now like our second goal report, And in the interest of direction from Mr. Wilson and brevity, I'll just say that I really still worry that these reports aren't just give us some data points. It's what do you and your leadership team see from this data about where we need to go next? And so one of the things that really stuck out in my mind in this report on page 6, where it's the chart on welcoming environment, percent of staff who feel respected at work based on the engagement survey. And so it's saying that the 18-19 data isn't available, so we only have the, I guess, 17-18 years for the baseline numbers. But I think it's, I guess I would like to understand where it's saying the data is not available for this reporting period. When will that data become available? So, yeah, so I'm trying to figure out, a really crucial part of this report is how we're doing in creating a welcoming environment for our employees. So we had it for families and students, but page 6 of the written report, it shows percent of staff who feel respected at work on the engagement survey. And so we apparently don't have the 2018-19 performance data, so we just have the 17-18 data. And I would like to get an idea of then when is this supposed to show up?
So the reason we don't have the 18-19 data is the employee engagement survey wasn't given last year. It was given this year, and I believe we just completed it. So the data for this year should be available later on this year. I believe around January or February it becomes available. We do at the back in an appendix talk about where the 17-18 data were. So you could take a look at where we were the prior year. So 17-18 we did do it, and that's in the appendix. 18-19 we did not do the engagement survey, so we don't have data. We did do it this year, and it will become available in several months because we just completed the administration of it.
Yeah, so the report actually on page 6 has the 17-18 data in it. It's not in the appendix, it's actually in the report. And I'm trying to figure out, again, for the value of producing a report where, I guess I would have said, maybe we have to push the report back because we don't have the data. To me, this is a big piece of what the report is. I mean, if we're talking about caring culture, we're talking about where our employees are at. If we don't know where our employees are at yet, then we can always wait. And I know you're sensitive, wanting to bring reports to the board as they need it, but I also think we want our reports to be meaningful. So I'll just say that I look at this and I'm going to be hopeful that things improve, because if you just look at that, I guess it's just not being brought up, the chart. Page 6 in the report, but where it's showing the baseline of 63% of teachers said they felt respected, 52% of support staff say they feel respected, 79% of our administrators feel respected. Well, I mean, that's great, and usually we find when you have higher positions of management authority, then, you know, that's, I just think there's something there.
Yep, and the baseline, remember, is 3 years from what years, Leedy?
14-15 through 16-17.
Right, so I am very hopeful that the baseline, which represents 2017 and before, that we'll see improvement since 2017. And when we have the data crunched, we will certainly be providing it to the board. And I do admit, one of the things that was a debate in these goal reportings in the fall about some stuff that wouldn't be in, and I will say I did make a decision that I believe the board needed to get the goal reporting done, even if there was some pieces missing prior to the budget. So I own that, but I still think in the long run, when we get this thing, and we can look at tweaking the engagement survey and try to figure out a way to get that data done beforehand in the future.
Thank you, Dr. Brabrand.
Well, I just, again, please note that the other thing I made a point was, we've really got to get our reports to the point where there's actually data analysis, not just data reporting.
Thank you, Ms. McLaughlin. I have Ms. Corbett Sanders.
Excellent, and thank you. This report is very helpful, and I do want to thank Dr. Brabrand for actually suggesting that we try to get as many of these reports done in advance of the budget so that they can influence our budget decisions. But there's another piece that I want to remind our board, my fellow board members about, which is these metrics were, we wrestled with putting in metrics in our strategic plan about a year ago, and they are subject to review, and I would hope that the new board, when it's convened, would take a look at the metrics to determine the usefulness of individual metrics and whether there needs to be some adjustments made to them. I do want to make a comment and just get some clarification, because a lot of this data comes from the youth survey, and the youth survey is actually currently underway again this year. And there's been some questions about the youth survey, why certain questions are in there, the extent of the questions, and what is done with the data once we collect it. And so for the benefit of those in the room and those who may want to watch later, and I normally don't say that, but I do think it would be helpful if we kind of gave a little bit of a high-level background on the youth survey.
So I'm going to give a high level, and then if Dr. Baylor wants to add to whatever I have to say, she's sitting to the side here, and certainly she is our expert, our Fairfax County Public Schools expert on youth survey. So youth survey questions are developed in collaboration with the Fairfax County government. Those questions are discussed through a group that works together, a committee that works together to determine what questions should go on there. We have input into what those questions are, and they typically, the committee tries to align them with other surveys, risk surveys across the nation, so that we can norm ourselves across the nation. And Dr. Baylor, is there anything else that we can add to that with a mic, please?
Thank you. So Ms. Johnson's correct. We use nationally normed surveys so we can have comparisons for national and other localities. The questions about the sexual activity questions, Dr. Payne can add additional information around this. Those questions were added around 2004, 2005 to 8 period, after concern in the community about sexual activity. We needed to query our youth to find out the frequency of occurrence, and the information from the youth survey led to the development of the FLE curriculum and addition to state curriculum as well as local curriculum. So the youth survey has informed our instructional curriculum, and we can see that we've had significant changes in activity, and behaviors.
And am I correct that we target resources to areas where we see concerns and make sure that we provide those resources to individual schools?
You are correct. We have started disaggregating the data by pyramid about 5 years ago, because we were able to more efficiently and effectively deploy resources if this risk behavior was more prevalent in one area than another. And we use that data. FCPS uses that data to deploy resources. So does the county in terms of setting up their after-school programs, their middle school after-school programs, and other offerings that they have, as do other agencies.
But it's not individualized data, so nobody is
No.
targeted as an individual. It's really as where there are hot spots that need
Correct.
support.
Absolutely correct.
Excellent. Thank you very much.
Well, thank you, Ms. Corbett Sanders. You've set a precedence. You left a minute 12 on the clock. I go now to Ms. Keys-Gamarra.
Thank you. First of all, thank you for this report. I consider this ongoing work. I wanted to look at the information regarding disruptive behavior referrals. And I know that this is all very preliminary because we just revised the SRNR. So a lot of my comments are going to be focused on how we're monitoring to make sure that we can get the most out of what's going on. So I wanted to talk about a couple of things. One, what is the source of the data? Are we getting reports from staff members, or how are we, because I don't know that we gathered this information from youth surveys. And then how are we monitoring successful schools where we're seeing numbers go down? I've actually visited some schools where the administration as well as teachers were raving about the fact that we've made changes and they were given tools. And I think that we see a different paradigm. We see a different level of success when you have administrative buy-in and the staff feels as though they are supported in addressing that and not just having things taken away from them. And then how are we monitoring those success stories as opposed to those that still may be struggling with the changes, which may be part of that culture change that we've talked about again and again, because we've been doing things this way for a number of years. Yes, it's time to change, but we've got to walk people through that. And so I wanted to talk just a little bit about how we're going to monitor that and make sure that we can get the most from the data as possible. And then also, if you could also address whether you see a correlation to chronic absence or anything of, if you do see a correlation. I wasn't able to, I don't want to jump to any conclusions, but would certainly love to hear your comments.
Sure, and Deb Scott can jump in here to fill in any of the holes I might leave here. The source of data is our student information system. So the referral data that is used for these purposes, all of that information was gathered out of our student information system. We have put some processes in place this year in order to engage the regions in more direct conversations about what's happening in their schools. So we're doing quarterly reports and having actually very soon here we'll be meeting with the region assistant superintendents and the executive principals to review the data that we have available, not only from some of the board-directed data we had to collect, but also additional discipline data that the region assistant superintendents have asked us for. So we will be doing quarterly meetings, and that's for the first time ever, our office with the region assistant superintendents. I have to say, adding the coordinator of equity and student conduct has made a tremendous difference in our ability to support schools. She's not only working with the schools in developing goals based on data, with their administrative staffs, and they're adding it to their school improvement and innovation plans, but she's also been able to meet individually with school teams in order to provide some strategies and direction for them. We are looking at Dr. Brayroom has tasked us with developing a common referral. We have never had a common referral in Fairfax County Public Schools, so we are using our student information system to develop a common referral that we'll be piloting in the spring. We're starting with some pretty high-level specific data, but our plan is to really roll into developing systems with EduPoint, our vendor for SIS, our student information system, to track interventions within our student information system, because we have not had the ability to do that. So this is kind of, we're phasing in, starting with the behavior referral. We're now, we have a committee working with the vendor and with principals to develop the intervention piece, because that is a big piece in our shift with our SR&R in order to be able to document and implement interventions prior to sanctions. So those are a couple of things we're doing. In addition, just last, Deb Scott and I met with the High School Principals Association to discuss discipline about a month ago, and we plan on doing a problem of practice with them in December again around discipline. And the correlation to chronic, we haven't done any deep dive into the correlation between discipline data and chronic absenteeism yet. We have some high-level chronic absenteeism data, but we have not done a correlation yet.
Sorry. I'll just follow up on that. With respect to the interventions, hopefully that will include monitoring who's using them, because I'm sure there is a correlation between actually, proper implementation of those interventions and decreases in behaviors. Does that mean we need things like mindfulness? Or I saw, and I don't know what it was called, but I saw a little blurb on them teaching this kind of rhythmic ball activity. I don't know if anybody knows what it's called, but in any case, there may be other techniques that we can try to explore. And then the last thing, I just want to make sure we follow up with our equity leads in terms of how they're feeling, in terms of their effectiveness, because again, how the administration sees their role, it feeds into their effectiveness and their ability to do their job.
Kathleen Waltz may jump in here, but we did a really fantastic leadership and practice activity with all of the principals last week. Will you talk a little bit about that? Because that was around discipline and the principals coming with their equity leads.
So we see the equity leads as being part of a school team, that they don't operate alone, but everybody has a place in the equity work. And so we have been providing significant amounts of professional development for our equity leads, but also to bring our principals and equity leads together for that work, to really focus on student discipline, to focus on the instructional program, to look at all of our work through that equity lens. So that was a very powerful opportunity for principals and their equity leads to not only learn together, but also start to formulate some plans. They had some dedicated time for planning.
And the other piece to that is our next module that we're working on with our equity leads jointly with principals, Module 5, is solely dedicated looking at discipline practices and how we're supporting interventions and what are we disaggregating the data to look at which students are successful. As you said, we want to make sure we're looking at the successful practices, but then also where we see areas of concern in the data, what are some strategies that collectively as a staff we can begin to look at? And each school has very different needs around that. So that is our next module that we're excited about in the spring.
Thank you, Ms. Keys-Gamarra. I have Ms. Derenak-Kofax next.
Thank you all for this report. I appreciate it. I'm going to start with I guess the graph on page 6 with the sleep, and then I also noted in the appendix and the larger report. I think there's a couple things. A couple of my colleagues mentioned this. I think when we decided to change the later start times, there was no doubt in anybody's mind it was the right thing to do for children at that age with their body clocks. I mean, we had the highest, medical and learning institutions telling us to do that. Unfortunately, it didn't pay off for us in dividends as far as hours slept, but that doesn't mean our kids aren't better for it. I think that's something that you need to look at. I mean, if you look at that, like we said, it's for several years, and I don't know how to address, we would need a status, how could you address, because in 2013, my 25-year-old son was answering this questionnaire, so you don't have the same cohort. There's no way you can get that kind of consistency. You're just at a loss for that. So there's no real kind of cohort you can follow to allow you to add that data. But I think what we see here, there's a pattern that teenagers, we all know why we changed the start time, and it was a good thing, but I think we've had negligible. And if you look on page 37 of the report, it says, of the full report, percentage of students who report healthy amounts of sleep on the Fairfax County Youth Survey. The baseline was 31, and this year we're a little down to 28. So the data is what the data is. But I think that's why you take everything into account when you are looking at things. I'm not saying it wasn't the right thing to do, and I supported it, but I'm saying the data doesn't show that our kids are getting more sleep from this. So, well, I'll be interested to hear, because this report doesn't say that, and I think it's But, well, I just think it's just interesting. So if that generates conversation that I need to hear, I think that will be good. I do feel that there has been, I like, I'm looking at the full page report, at the full 32-page or 37-page report, and I do, on page 25, page 32, you talk about progress made, and I think that's important for us to look at as a system, because I think there have been so many things done to adapt to this caring culture, and I think if you look at that, and then you talk about return on investment, that's return on investment, but page like 25, page 32 of the full report, there are different strides being made. So I just want my colleagues to look at that. I think those are highlights, and then I will take a go back, and I will look forward to how my colleagues interpret the data.
Thank you, Ms. Derenak-Kovacs. I put you down for a go back. I have Ms. Hines.
Thank you. So yeah, just to start off, I mean, I think this is, shows us the power of strategic planning and reporting, right? Because now we're reporting to the community on lots of different goals, how it's going, what we're doing. Obviously the next step for us is to figure out how the board and leadership staff responds and maybe changes what we do. But to have this information for the public is wonderful. So thank you so much for all the work that just goes into reporting all of this. I had a few questions. Just for the sake of the public, when we talk about discipline referrals for disruptive behavior as a measure of how equitable our discipline is, can you just remind people who may not know why we have found those two things to be related?
Yes, that they are based on the D codes, and there's always going to be subjectivity on the, is that your question?
Yeah, so I mean, I think my understanding is that we have found in the past that that's where a lot of the inequity or overrepresentation of certain groups in discipline referrals tends to happen in those subjective type discipline cases, yes?
That is correct, and that is why the equity work is so very, very important, and also the work in MTSS. Ms. Johnson spoke about all the Tier 1 behavior training that goes on, or training for social emotional learning. So that's why you have to have such a strong Tier 1 program, and especially social emotional learning lessons that teachers are working with students and learning along with students. So yes, that's how you kind of combat that subjectivity.
Okay, thank you. I just wanted to lay that out. So when we talk about then interventions before discipline referral is what we're talking about, right? Is like intervening with kids who may have landed with a discipline referral for disruption or something, but we're going to intervene with them first, right? And we're keeping a record of those interventions now, is that right?
That is not as clear at this point. That is when Ms. Johnson talks about the other module. The first module is the behavior referral, trying to get that all on the same page. The second one is to develop a very strong intervention program and module so that teachers are easily able to use that. There is some of that does go on. We have some great data from our school social worker and psychologists in Tier 2 and Tier 3. But do we have it system-wide? Probably not yet.
But that's something we're shooting for, yes?
Yes, that's the plan with our vendor, EduPoint, in order to build that into our student information system. Right now, it is done differently at schools, even though we do have a mechanism such as our EDSL system. However, it isn't being done consistently, and that's why we feel very strongly about building that into the SIS.
Thank you. So from the perspective of the school board, when we're in our closed student discipline meetings and we're talking about kids, often the question or the conversation comes up that we just don't feel like we can only work from the written record on a student's past, and we are always wondering, well, did people do enough at the school level to, divert and intervene with this kid? And we want to know that before we send them to an alternative school and feel like, well, we might be derailing their education, but we don't know what's already been tried. We assume, But, so I'm kind of, I guess I'm bringing that up, and maybe I'll talk to Mr. Dr. Brabrand about it too, is I think that this kind of record keeping could really help the school board in our discipline decisions as well, if that's in the written record for a kid.
And once that's built into the student information system, then we will be able to pull that out, and you will have access to that in the written record as you're reviewing each student. So absolutely, right now what has to happen in many of those cases, the schools have to submit to us what they have done, and often it's in paper, some is in Excel sheets, it's in various forms. So schools are keeping track of this in some cases, and in some are not. But this will have a way that anyone can immediately pull it right out of the student information system. So we are working on that, and we're really excited about when that will come very soon.
Good, great. So I would just recommend that we make sure that ends up in the written record for kids who end up in front of the board.
Absolutely.
Yeah, and then finally, I guess I have a question about, and I will ask, and maybe Ms. Evans is going to get back to this, but I also think that changing to Indigenous Peoples Day from Columbus Day is something that we should definitely be pursuing when it comes to creating a caring culture and a welcoming environment for all of our students. And I guess I'm just wondering, if we want to talk about it a little bit tonight, what would be the mechanism for making that happen? I'm assuming that this is a decision that is just made by the superintendent, or because it's not I don't know, because it's a calendar thing, maybe the school board would have to vote on it. But I hope we get a chance to talk a little bit more about that tonight. So thank you.
Thank you, Ms. Hines. I have Ms. Strauss.
Okay, thank you very much. I'm not going to report all the questions and issues that have already been raised. One question, as we, again, look at our data gathering to guide us on policy and changes in fund spend, et cetera, I'm assuming that it is still, while we can look year by year, et cetera, with big data sets, we don't know if we are testing the same children and whether or not the children, individual children, are making progress. And that's just kind of a challenge. Are we testing different children? We probably are, but that's a problem with any kind of testing.
If you're referring to the youth survey?
Yeah.
Yes, there would be a way to follow a cohort.
A cohort,
And I'm going
yeah.
to look at Dr. Baylor right now, because there is a way to follow a cohort, but you're still going to have
I know.
changes within those students.
I
don't know
know.
if there's anything she can add.
Because then, again, you know, what would be really nice is you have a child who had an issue or a problem, you know, we went in and tried this and we tried that. At the school level, they will know, did this child really do better year by year as a result of what we've been doing? But the school division, to know where some of those big decisions are made, it is that progress of individual children.
So I'm also looking at Leedy because I think she can bring her statistical and analytic mind to this as well. We did look at cohorts a couple of years ago because if you look at the 2012 eighth graders illustratively, there are 2014 10th graders,
Right.
and there are 2016 12th graders. But because of the changes developmentally and the engagement and risk behaviors across time, it was hard to make a determination on whether or not their changes were significant relative to other cohorts. And we didn't have enough longitudinal data to look at multiple three-year cohorts.
I know.
We're getting more data, but I think Leedy can attest to, and many of you know, that when you're looking at research and at comparison groups, you don't need a super large N to make impact. So we have a lot of data on individual students, and a lot of times you can extrapolate that data to other cohorts of students with similar characteristics. So I don't know if you want to add anything about that. Not to put you on the spot.
We can certainly do that same kind of tracking for cohorts, just to show you sort of the trend lines for it. But it is difficult sometimes
I
because
know.
the development of the students are different, and obviously you
change.
see the trends regardless which
Right.
year you're looking at. There's bigger differences between grades than there are in the cohorts themselves.
I
And
know.
so, but we can certainly track that and put that, if you'd like, as a next step.
Well, I don't know. I mean, I know how difficult that is, but I know at the school level or the grade level, if the teachers have been there long enough and they can see the progress that an individual child has made. And that's always kind of too bad that progress, because that's real on-the-ground progress. It's very hard to capture that at this level.
The other thing, and Dr. Baylor can speak to this too, our youth survey is an anonymous survey.
I know.
And there's specific reasons we do that, because many of the questions are sensitive.
Sure.
However, there's also the benefit you could get by not having it be anonymous and being able to have a better sense of what's happening with each child. We've opted for the anonymous side of it, but that could also be something that is considered differently if that's something the board wanted to pursue it.
Because I remember when we first decided to do the youth survey, and having it be anonymous, I think, is the right way to go. And I know there are trick questions, so we can tell whether or not the kid is just blowing it off. That's always kind of fun to see how that works. But at any rate, I think this is all really very useful. It gives us good direction. But again, I remember Dr. Dr. Sockwell, and, for years, people always say, the longer we have a child, the longer they are with us, we tend to see growth in whatever their needs are. Not always, we can't save every child, but by and large, it's like our ESOL kids. The longer they are with us, and after they get to that 5th year and are out of WIDA, many of them actually achieve at higher levels than anybody else. And so, how do we tell that story in all of our reporting? It would be nice, but I know it's very hard.
Dr. Brayray?
If I could, just Ms. Strauss, and to the rest of the board, and Ms. Johnson, check me on this. These are some conversations I feel I've had, and if I've captured it wrong. One thing, Chairman Corbett Sanders talked about relooking at metrics. Goal 2 has a lot relying on the youth survey. We as staff want to, as we go back to talk about data and analysis, analyze whether that's the data pool good for some things. Maybe there are other data pools for other things that we can do better. And I want you to know we're actively looking at that. As you heard Ms. Johnson mention, we're going to standardize the referral reporting mechanism for schools, right? They've had a different way to even report referrals. So I think there's some new data sources that as this board transitions and we have a new board, Chairman Corbett Sanders, to talk about reviewing the strategic plan indicators, I'd like to bring some ideas from this team about some other data sources. Not going away. The youth survey has an important role. It has good information, but there just may be some other sources that we want to start to use, and a good opportunity to pull some of that in as we move forward.
All right, thank you, Dr. Braybrand. So I have gone through my list of initial turns. There are a couple board members who didn't take one, so this is your chance to ask some questions now, failing which you will go to the bottom of the go back line. So if you want to jump the line, now's the time. Okay. Before I start go backs, I'm going to take a minute because I want the public to know a couple of things. The documents we're talking about include several different documents. They are online. It's a very comprehensive report that's available to the public. If you're watching this online and you're wondering what are they talking about, page 35, all of those documents are available on board docs through the FCPS website. If you go to the school board, you can click through and find these documents. They are available online. With regards to the documents, and I'm not sure who's the best person to answer, maybe it's Dr. Duran or maybe it's Ms. Johnson, there are a couple aspects to the presentation that at least as one board member had me scratching my head a little bit, because we're talking about a caring culture, yet we're using terms like return on investment. And I wonder whether you can explain, how when we're talking about a youth survey, are we talking about return of it on investment in that report? I think that sounds good. I think that's a little bit confusing. And then secondly, there are several places where we've got no progress indicated. And I wonder if you could just touch briefly on why that is showing up. Because I think it has this very strong negative connotation, but I think in some cases it's really not that negative because of the way this report is prepared.
Well, in terms of the return on investment, I'm going to ask Leedy to help talk about that. The return on investment is the structure that we put in for all of our goal reports. We do agree that in Goal 2, caring culture, that is a little difficult in times, particularly when it's qualitative data that we're referring to as it relates to youth survey. So that is a challenge, and it goes back to what Dr. Brabrand was just saying a minute ago in terms of what data sources are we going to use to show in this report so that we can have return on investment that's a little bit more aligned to that. But I'll let Leedy talk a little bit more about the structure of return on investment.
If I could, before Leedy says that, one of the things I want to talk about is we standardized every goal report. We may want to have a little more flexibility on some goal reports where the quality of the kind of data doesn't fit as much. The ROI is a great budget tool, right? It's a great strategic concept around budget, but for some pieces, it may not be as powerful, and I think that's one of the things we want to talk about too. But for purposes of this year, we wanted to bring that approach through all of our goal reporting as best as possible. And we may want to have some flexibility about which places does ROI really fit and is tight, and where maybe there's still more room. But I know the definitional piece, I know Leedy can share.
And also, Leedy, if you can also talk about your second question when you're about limited progress, which is the green, the light green, that is also a standard report for all of the goals in terms of whether it's limited, whether it's did not meet or progress towards the target. So there's a formula for what we do, how we coded those in the color, and Leedy helped us to do that.
Okay, so I'll start with the colors, and then I'll work my way back to the ROI. In the report it's on page 2, it discusses how the colors are used, and so no progress basically means in comparison to where we were at baseline, we have not improved since that point. So that would be the yellow color that's used. The green color is used when there has been some improvement since baseline. However, there hasn't been any improvement from last year. And all of the goal reports have an appendix at the back that also shows you the data from last year so that you can see that comparison, but that shows up as a green color. The teal colors are used when we're either making progress, which is the lighter teal color, and we're making progress towards the target that we've set, and then the dark teal is when we've actually met that target already. So those are the 4 different colors that are used, but no progress means that we really haven't progressed since the baseline. The second question about the ROI gets a little bit tricky, but the primary thing that we're trying to look at when we do the ROI is to look at the actions that the school division took, in this case, during school year 18-19, what were the things that we were trying to do, and then try to put a numeric value in terms of how many dollars were spent on it. So what was the investment in that particular action, and then try to relate it back to what's the related outcome look like. So for example, if there's no progress, you would be able to match up to, here's the actions that were taken, and it's to try to help with decision-making about, are those the best actions to take, or do we need to put other actions in place? Or if we are making progress, to make sure that we continue to do those actions and relate it back to the investment that it costs in order to make those actions. In some cases, we are able to actually match it up with whether progress has been made and to try to put a dollar value attached to how much it costs for that progress to occur in the year that we're looking at, in this case, 18-19. And we've done that across all the goal reports that way.
Thank you for that explanation. And Dr. Brabrand, I would concur. I think that the next board should look at the use of that terminology, because as somebody coming from the world of commercial real estate, that does not line up to the way what a return on investment it means in terms of an investment. So we might want to relook at that, because I think people out there might be scratching their head when they read what we're calling return on investment when we're talking about the caring culture. So I think that is a good idea to look and rather use some other terminology to describe what we're achieving or not achieving when we're making investments in various aspects of the caring culture. Okay, so now we can start with the go-backs. The first person is Ms. Evans.
Thank you, and I will go back to sleep. Thank you for raising that, Ms. Darren Kofax, and thank you for your support of later start times. The first point I'd make is that when the overall amount of sleep is consolidated for the youth survey, then the gains in high school are masked by the reductions in middle school. So you've seen, if you go to well, it's right up there. If you look at, we approved later start times on October 23rd, 2014. And so in 2014, for 10th grade, the number of getting, the percentage of 8th graders, or I'm sorry, 10th graders getting 8 hours or more is 22%. The next year, when we established later start times, it jumped up to 28%. That is a huge jump in the number of kids getting sleep. Now, we didn't break that down further, but that is a big jump in the number of students getting 8 hours or more of sleep. And you look at 12th grade, it went from 14 to 17%. Again, that's not good enough, but when you combine that with the reductions of the 8th graders from 50% to 48%, then you get something else. Also, you know, as I said before, the way that our numbers are showing anybody who didn't answer the question is listed as somebody, not in the youth survey, but the way we do the numbers, anybody who didn't answer the survey was listed as not getting 8 hours of sleep, and I don't see why we would do that. That makes no sense. Why would we assume that? So I'm suggesting that in the future, we go with the youth survey numbers because they're consistent. So that's, you know, so I would say that this shows not enough progress by any means, but it did show, I would say, a remarkable impact of later start times. On the same note of sleep, the School Health Advisory Committee has been asking for some time to have the youth survey ask a question about drowsy driving. And this is a very critical question. How many of our teens are driving drowsy? Because it's very dangerous to drive drowsy. It's just as dangerous to drive drowsy as it is to drive drunk. Because you can be sleeping, while I'm texting. Right, and we do ask that. So since we have had that from our, from SHAC, I would ask that the board have as a next step that we support adding a drowsy driving question to the youth survey. I think that that could be an important statement to make in the next round as we do that. I think they're going to be considering that. And last but not least, I'll go back to Indigenous Peoples Day. I don't think that that's something that we can decide tonight because we haven't had a conversation about it. However, one thing we could do if the board is willing would be to, Ms. Hines asked what would be our process for doing this. And one of the things Ms. Hines and I were talking about earlier was asking the calendar committee to take a look at that. So I would ask the board if they would agree as a first step to ask our calendar committee as they're looking at other issues if they could take a look at the issue of switching Columbus Day to Indigenous Peoples Day. So I would ask that that be a next step.
Ms. Evans, can I clarify that? By the committee, do you mean the existing committee or the task force we're convening?
Well, we do have two, don't we? And I believe the calendar probably, well, it could go to either one, frankly. I mean, one is really on religious observances.
The task force is focused on religious observances that's directed by the board. I mean, you could certainly ask them to look at that as well. It's a diverse group of stakeholders, but there's the separate calendar committee that works through human resources, led through them. So yes, it's important to get clarity which one you'd like to look at that.
And frankly, well, refer to PEC.
Thank you, Dr. Duran.
Well,
I think it's a next step, so let's
Next step.
refine
All right.
your question when we
Okay.
get to next steps.
All right.
Okay, the next person I have is Ms. McLaughlin.
Thank you. Clock, just so I don't, honesty, right, exactly. First of all, Ms. Darna-Kofax, the reason why I was interjecting along with Ms. Evans is that, first of all, in the United States, very few people, adults, are reporting 8 or more hours of sleep. Therefore, very few parents and very few children are getting the 8+ hours of sleep. The data point itself isn't very good. We should be having something that gives it a little more slicing to, is it 6 or more hours? Is it 7 or more hours? Because I do think that if we went to that, a more realistic area of how much sleep were they getting. If they were getting 5, now they're getting 6, that's better. We're just not getting captured because a very tiny number of people in this country are getting 8 hours, including this person talking here. The second thing is that what we also know for certain through the science is that it's the circadian rhythm. So we can't say in this report at all that the later start times didn't create it, because they could still be getting the 6 hours sleep they always got, but they are more alert by their circadian rhythm when they start school. So we have to make...
Absolutely agree, absolutely said that.
Well, but you still said the data point shows that it didn't bring the impact that we wanted, and I think that's not true. So I think it's really, really important that if we don't have the right wealth of data, then we do a disservice to not only this school division, but to the nation who's looking to Fairfax County Schools. So that's just a point I want to make.
If
And
I
then-
could, Ms. McLaughlin, just to say, I love the feedback about the cut point at 8. If we could trim it back 7, 6, 5, I don't know whether we even ask kids
The youth
that.
survey question results are broken down 4, 5, 6, 7, 8, 9, 10 hours, so we certainly can provide that. The reason why there was 8 is the question that was posed was 8 or more hours by the board on, this is a follow-up to a question that specifically asked us 8 or more. We do have it broken down because the youth survey asked the question, how many hours of sleep do you get? And then it's broken down 4, 5, 6, 7, 8, 9, 10.
So just listening, I mean, again, this is the growing process. We set the metric there. I think we can go back. That's a metric we can tweak and perhaps show the range starting at an earlier number all the way up to 8 to get to that piece.
We'll be happy to get that, and we have that data.
There's not going to be enough time in mine to go through all my concerns with this report, so I'll just go as high level as possible. Throughout this report, things like saying that the return on investment, when we added the 9 social workers and the 9 psychologists, that it didn't show a return on investment because of one data point on basically saying, I guess it was, that where we were on students talking about their healthy behaviors and the social emotional skills. I mean, there's just things in this report that I went over to Mr. McElveen, who works for the Brookings Institute. When we produce reports, they have to be something that researchers even would look at and say, can you make that conclusion? Can you make that statement? And we're doing so many really important things and where we're investing our money, and yet the way this report is so like singular-minded and on singular data points, and we're basically making statements that I think don't reflect well on the system. They don't reflect well on the good work that we're doing, and I think this is actually doing more harm than good. And so I don't want to have staff just give me 8 hours or more because I don't know what conversation where that occurred that we said it would be 8 or more. I want staff to be able to say, hey, I know the metric was 8 and it doesn't look that great at 8, but we actually got to see all of the data, and the good news here is we went from kids getting 5 to now this is 6. Like, I want to empower you and your leadership team to produce something that, again, with your doctoral degrees and PhDs, you can stand behind it and say the conclusions and things you're making, not just, well, we understood it was going to be this singular metric, and so we wrote the report to this singular metric, because this thing is
Dr. Brabrand,
full
do you
of...
want to respond?
Yeah, it's just...
I would just think it's partnership, it's new. This strategic plan, I believe, is better than what we had before. It was made clear to me when I got here that this was the board's strategic plan. So we've worked in partnership with you to build these metrics targets. Are there tweaks that need to be made? Absolutely. I'm willing to make them, and we will in the months ahead.
Scott, I'll just conclude my time. I don't think it's about tweaks. I'm going to once again tell you there's no way I can sign off on this report because I don't think it does justice to you, your leadership team, and everyone who's working hard on these things. I'd like to actually see us maybe look at how do we fix this, and finally we have to at least get rid of a lot of the acronyms in there. Some you do a great job, but others like MTSS, VDOE, things that the public can read these and not know what it means. SAPs,
Ms.
things
McLaughlin,
like
would
that.
you like to get back on the go-back list at the end? Are you, Are you thinking? Okay, so you amply used up the time that Ms. Corbett Sanders saved on her turn, so I think we're now even. The next person I have on my list is Ms. Schultz.
Don't start it yet, hold on. Top of page 3. Go to the top of page 3. Don't run that. So this says, utilizing the Fairfax County Youth Survey, to interpret and present data to administrators and school staff on how to increase school, family, and community assets. I don't understand how the youth survey briefings results in increasing the assets of a student. In fact, we've actually, that's a flat line. So hold on, I've got to ask all my questions. That's number one. The reference to the fact that in 2004 or 5, some people were concerned about the sexual activity of our children, and we decided to add sexual questions into our youth survey. I'd like to know who those some people are or were, and what their concerns were, and whether that's documented somewhere. And I ask this because you said that they were that the youth survey is informing instructional curriculum. So children's answers on a youth survey that are anonymous inform our instructional curriculum. What part of our instructional curriculum? Our FLE, our health? I'd like to know the answers to that. Both? How? How does it inform it? Because we have 4 times as many students on our FLECAC as we do adult members of board member appointees. Dr. Brady-Brown, would you like to guess how many times the word sex appears in our youth survey? Just a guess. 174 questions. Guess how many times the word sex is used? Anyone? Anyone? Anyone want to try a guess? 110 times. 110 times in our youth survey to 8th, 10th, and 12th graders, we use the word sex or sexual in 174 questions. Do you ask your employees when the last time they had sex, did they use a condom? We would never ask our employees these questions, ever. Have you read the youth survey? It's appalling. It's an appalling level of invasion, and we're teaching children that you should, in the most private aspects of your life, surrender that information under the guise that it's anonymous to the government. It's a terrible idea, and you have said, Ms. Johnson, that Goal 2, the Goal 2 report, relies heavily on the youth survey. So we are using our Goal 2 report on students based heavily on information that comes from children. I think it's a terrible situation that we've put ourselves in based on some people who said something in 2004 or 5. I think we need to re-look at this, but I would love an answer to any of the questions.
Well, I'll start with the first one. Utilizing, we have a plan. We've been working with our clinical supports, the psychologists and social workers, to look at the youth survey data and have them share out with individual schools, because the plan is there's a lot of national research to support that students who have more assets or protective factors are less likely to engage in risky behaviors. We have a goal. We actually met with SHAC and had a very large conversation at SHAC last month about how we can help support the community and how we can get the word out about how to build assets, because assets are built by community, family, and school. So that's how one.
I just have a question. I just have a question in response to that, because one of the questions says, specifically with regard to assets, there are, and the answer to this question appears 35 times. There are lots of adults in my neighborhood I could talk to about something important. That's actually kind of creepy. I don't want my children talking to lots of adults in the neighborhood. But the answer, and this is the thing that occurs 35 times, the answer Their choice is no, capitalized with 2 exclamation points, no, small letters, yes, small letters, or yes, all caps with 2 exclamation points. Can you please tell me what the statistical interpretation is of no, no, yes, or yes? How do you determine assets when you're asking students questions like that?
Ms. Schultz, let's let Ms. Johnson answer the questions that you presented, and we have another round of go-backs for sure, so we're more than happy to add more questions.
So I will have to ask Dr. Baylor if she even knows who the people are that had questions in the community about the sexual questions. And Dr. Baylor, do you know that?
I do know it, but I know it because I asked my colleague, Dr. Payne, who will answer the question.
So I do not have written data on this. This was a discussion at FleetCAC years ago, and I brought it to the attention when we used to meet with the Fairfax County government to see if there were nationally normed questions around these topics, and that's how they were added. As a result of information that came out of the youth survey, that's when we started adding information about especially oral sex being a risk factor for sexually transmitted infections. So that's how some of the data had been used.
And at the time those questions were added to the survey, they were added to the survey, I believe Ms. Strauss, you were on the school board at that time, so you might be able to enlighten the school board about some of the conversations that occurred. It did not happen without the approval, consent, and endorsement of the school board.
I suppose if you wanted to add something, I'd rather have staff, but if staff is done answering that question, Ms. Strauss, if you want to add a gloss to it from your recollection.
Sure, because I predated staff. I've twice been on the committees for that survey. When we first considered it, it really came from the Board of Supervisors and the Health Department. And they were looking at a survey that had national data that would help us identify, and originally it was what kind of services the Health Department and the county needed to provide, either for funding to the schools or through the Health Department, mental health, risk factors, beds for children with mental health issues, and risky sexual behavior. That was a huge issue of concern. The oral sex came in because actually it was exploding in middle school. And the kids were not getting sexually transmitted disease information, and the health department was beginning to see illnesses that were very preventable, and the kids were not getting the right information. So that many of the questions on risky sexual behavior has come from a desire from the health department that must treat and provide health resources from the medical professionals. They were at the table when a lot of that was added to make sure that children were being properly educated against risky behavior and being able to understand, was it going on? Was this just all a rumor? And how do we work hand in hand? And yes, every time it was revised, it came to the school board. It looked particularly at any of these unusual questions. And there were also making sure that there were opportunities for parents to see the questions and for parents to opt out, because there always are parents who would rather the children not be questioned on any of these, in any of these areas.
Right. Thank you, Ms. Strauss. Therese, Ms. Johnson, are there other questions you need to answer or you can answer for Ms. Schultz?
No, exclamation point, exclamation point.
Or is that no, lowercase, lowercase?
All right, thank you. Thank you, Ms. Johnson, and thank you, Ms. Strauss. Your historical perspective will be sorely missed on the board. You bring a lot of history and knowledge, and that will be greatly missed. All right, so next on... Speed dial, yeah, at the table. So the next person I have is Ms. Karen Keys-Gamara.
I actually just had a really quick follow-up with respect to the equity leads, and I appreciate the collaboration of working with them with the principal, but I also know just from general human nature and the fact that you've got an employer versus an employee relationship there, I'd like for perhaps to discover or look at a way that we can get information directly from equity leads or folks working in that area, because they can give us an idea as to how receptive the administration may be, or even their fellow staff members, in a way that perhaps leadership may not be able to.
Yes, and we do meet with the equity leads quarterly just with them, and then they break up into their regions with their region specialists where they can have that type of conversation. So we do both. We bring them together with principals, but then we also bring them separately as well.
All right, thank you. The next person I have is Ms. Darren Kovacs.
I actually had a question on the equity leads too, so that opened up the door. So I know when this report was established last year, we were in the infancy and we're still kind of on the building grounds. But Francisco, what is like do we have an overall plan and strategy for the equity leads as to, you know, this is what we want to see them do, or, you know, like, I guess a strategic plan for the equity leads and teams and where we're going with them now that they're kind of established and they're working and they've had their training?
So yes, it's ongoing in development. This is just the second year, but we do have some key deliverable actions that each equity lead should be doing with their school. We did provide a little bit of that when we had our equity report, and I had an equity lead here to talk a little bit about what they did, but absolutely. One is to really help them look at data. So we wanted to look more at that, and that's part of what our module is this year, how we begin to look at data differently. Two, it's also just the development of understanding. So at this last equity lead joint meeting with their principals, we talked about some tools and resources that we could provide for them to look at what are the equity needs at their schools. So we really want to make sure that we're empowering conversations to happen that have not been happening, questions that are asked, and looking at things in a different way. So that's another piece. And then also just being a support around helping provide more professional learning opportunities for them to bring back that learning to their site. So that's where we are right now in the infancy stage. I would say we have some equity leads that are doing above and beyond that, some that are just beginning. And so, but we definitely have a plan moving forward with that.
Okay, thank you. And I think this one goes to you, Dr. Brabant. And this is more like general, because we talked about the other goal report the other day. I think I was concerned when I looked at, I think, I can't find the page here, but it was like no progress made at this time to find, you know, the 3 assets, but really it stayed the same. It was, you know, and I think, like, if you're reading it fast and if you're the public, there may have to be some kind of differential there, like particularly if it's that high, you know, it's like no progress made, but asterisks or star, you know, I think that's important.
Honestly, our reflection, we were hard on ourselves the way we structured the report. We were. Because my focus at the time was thinking of it through the lens just of accountability. But we also, what I've heard, we need to give credit for what we've done or where we've been at high levels and acknowledge that. And I think there's a way in the reporting, and even from your conversation earlier in the week, putting some of the good news, the public's not everybody is gonna read 80 pages. No. We need to put almost a one-pager up front that really tells the narrative. It may still have some grows in it, some things we fell short, but we really need to be talking about where we met or exceeded, where we made progress, or whether we maintained high levels. And I think we can do a better job of communicating that as we come up with the next. This is strategic plan version, in my view, 1.0. And I think we can start to, with this feedback, really make the next set of goal reports you get much more on target to trying to capture those essential pieces.
Right, I think you used the right narrative there. You said maintained our high level.
Yes.
Yeah, that's important, because then, you know, like you give us credit where credit is earned. You know, I mean, if you're achieving at 80, even though your goal is 90 to 95%, but if you're at 87, 85%, and you haven't made progress, but you've maintained, I think it's important to note that and differentiate that somehow in the survey data.
Thank you, Ms. Darren Kovacs. Ms. Corbett Sanders.
Couple things. One, I wanted to just briefly mention that the Indigenous Peoples Day, that is a subject that is not only of importance to this board, but I know that the delegation going to Richmond are also entertaining a change in language. So just wanted to make sure people were aware of that. Did want to also, on the sleep, ask a question. And if we can go back to that chart where it showed over time, and I'm looking in particular at the 10th grade. We changed our policy in 2014, so it was implemented in 2015. What happened between 2013 and 2014 that we dropped down to 22? Then we went back up to 28, but now we're back down to the 26. Do we have any sort of, have we unpacked that data at all to better understand it? No, okay. Well, the good news is our kids are not spending more than 3 hours a night on homework, which means that even if they're not sleeping, they are able to perhaps do other things that are not quite as stressful as doing more than 3 hours of homework. So maybe that will help in anxiety. Pardon me? Yeah. No, it's actually a 5 percentage point drop from 2015 to 2018. So that's one thing. The other is when back to the page we were just looking at, it talked about the cognito training. And I've talked to a lot of our high school kids who, some know about cognito, others don't. What are we doing to promote these mental health tools to our students? Because I'm concerned we have some good programs out there, but we're not necessarily doing what we need to do to get the word out that we have these tools available to kids.
So that friend to friend is part of the 10th grade health lesson. And so this is the first year we've had one-to-one so that everyone has a device and is able to access it. They also are able to access it outside of the classroom. So we're sort of in that infancy of having it for every child. So it is part of the curriculum. We can certainly look to, I can chat with our high school specialist to talk about how can we promote that better.
First rolled out the texting app for help. We had signs up in the schools, and we did some promotion. I'm wondering if we need to do some of that type of promotion for some of these other tools that we have out there.
One thing, may I?
Of course, Dr. Burbank.
Chairman Corbett Sanders, one thing we've been talking about, now that we have FCPS on, and I don't have it today, so I don't have the, I know there might be questions after I throw the idea, but an idea that we're working, and I'm just throwing it out for the board to hear it now. How can we take things like Cognito, right? Now, for the first time, almost like with this phone, where you have apps that are already built in, right? When you open the phone, when you open that laptop screen, what are some different apps or supports that are already up, including for social emotional supports? So that is something we've been talking about, and how can we, this year we got it out, but now how do we put in, we've had some of these pieces here where when that kid opens it, it's already a default for a social emotional portal of different pieces. And so it's something we're starting to talk about, and I'd love for Cognito to become part of just like a panoply of tools for social emotional that kids could go to. Like you said, what to do at night when you're not doing homework? You can go on this place and explore and learn more and have it as have it as a way to capture kids and get them interested in, and knowing there's a reach out. There's just a button there to push and learn more about the resources
As
and
long
supports.
as they're not doing it while they're in bed and having it next to their bed.
True.
No, but
With
what,
the blue light
as
off.
a next step, one of the things I would suggest is perhaps having a plan for communicating some of these social emotional health tools to our students, including we might even use our television studios and have our kids do some of their own marketing blips.
I will just add one thing. We did push it out to every student's Blackboard site last year. In addition, I thought there was an icon on every student's desktop for FCPS on, but I'd have to look at that.
Thank you, Ms. Johnson. Ms. Hines?
Yeah, thank you. I'm just going to push back a little bit on the idea that we should change how we talk about this. I think we should be hard on ourselves. I don't like the idea of saying, instead of, did not progress, saying that we maintained. I'll tell you why. Because I think we have goals because we're not happy with where we are. So if we're willing to say we maintained our already high level, then why are we even looking at that as a measure, right? We have a goal because we want to get better, right? And I would point you specifically to slide 8 of the presentation, if we could. This is the number of staff referrals for disruptive behavior. And if you look at this slide, you can see, so our L kids, our English language learners, I don't think we want to say that we maintained there, because that's not what we want, right? Basically, those kids are referred for disruptive behavior 4 times as often as our Asian kids. That's not acceptable. We don't want to say we maintained our already good work, right? So I think the community wants a summary is fine, but I would not want us to sugarcoat what we're doing at all. I think it's good that we're very honest with the community about what we're doing. So my thoughts.
Okay, so I've gone through the initial go-back list, and I think there are a couple people that want another go-back. There were a couple people that did not take a turn yet, so you're going to go back to the end of the go-back line again if you don't jump in now. All right, so, and I think one taker, so Ms. Palchik.
Yes, very briefly. Just going back to your question, Ms. Evans, and I know they've stepped away, but I do agree with the looking at the Indigenous Peoples Days. I wanted to clarify my comment from earlier, and I think someone brought up PEC. To date, the calendar committee has been told clearly that they're not doing policy, that they are to make recommendations within the school board's provided framework. Thank you. So just wanted that maybe that should start with PEC, start with us, and then go to the committee. So I just want to make sure that we have that clear, but I do support the effort. That's all. Thank you.
All right, thank you, Ms. Palchik. So I'm going to react a little bit to some of the comments that other board members have made, and perhaps you can answer some questions for me about this survey. Frankly, given Ms. Schultz's description, I feel like maybe we're giving a bad, trashy beach novel or something to the kids. I know that's not the case, but it does raise sensitivities in my mind as a parent that if we're asking questions that would cause most parents to blush in answering them, I would go back to a request I made to this board on FLE in past years, and that is we need to get consent and err on the side of caution before having the children answer questions without their parents really being aware. We need to know that the parents understand what the questions are, because I think that's probably not the case for a lot of parents. Within the survey itself, does the survey provide for a warning or anything like that in the survey? The following questions contain sensitive matters. You're not obligated to answer these questions. skip to question 32 if if you don't want to answer these questions. Does the survey contain that sort of warning for the students?
It doesn't have warnings to the level that I believe you're asking about, but it does say this next set of questions can center around this certain topic like bullying or sexual activity.
Yeah.
So, yes.
So,
And it does say in the directions given to the students that they may skip any questions that they choose not to answer. So they do have that option.
Okay, yeah, and I think, I worry that students might walk out of the survey feeling a little overexposed after they've gone through the questions. Now, obviously, if they've done it before and are doing it for the second or third time, they know what to expect. But I think that sort of caveat to provide children the opportunity to not engage in something is important. I happen to be the parent of a very sensitive young man who is very sensitive to things he sees, reads, hears, watches, and they don't go away once those thoughts enter his mind. Sometimes for years he'll continue to circle back to the disturbing idea that was put in his head. So I think we got to err on the side of caution in terms of being that caring culture. And I also think, and maybe this is a next step, we ought to do some post-survey reactions of students, so we can know the students took the survey and they handed it in, but what was their thoughts about the survey itself that they were answering? Did they think the questions were appropriately worded? And I think the points raised about number of explanation points or caps. I mean, how surveys are structured and how questions are asked is a source of social science, and I think we ought to get information from students, maybe on a voluntary basis, about what they thought was the best question, what we thought was the worst question, which question they thought was too intrusive. And those sorts of questions I think would be helpful for the board to have answers to. So, with that, I will go to the next round of go-backs. The next one is Ms. McLaughlin.
So on page 21, I wanted to just first of all compliment Dr. Brabrand, your staff, the listing of all of the actions that the school division's taking to address healthy social emotional skills can't be understated. So I do appreciate the intense accounting that's listed here, but would maybe ask, for example, I think it's bullet 3 on page 21, where it said explored reasons why students are reporting higher levels of stress and took efforts to reduce extraneous stressors within the schools. I mean, that's a really important bullet, but the board and the public doesn't necessarily know what those were. So as a next step, I would like to maybe get a little bit more detail on that. It's not time sensitive, but I would like to be able to share that with the public, since they have been telling us this is a really important area of focus and concern, and I want to be able to celebrate our commitment to that. And so then I also wanted to suggest that for the future reports, another data source is the Behavioral Health Management System, if I've captured that correctly. So that database, I think, could serve this report quite well in understanding what's happening within the buildings. So I wanted to point that out. And then I guess finally I would say that I would welcome Dr. Brabrand that it's not just the board's direction, but you and Dr. Duran and your leadership team, let us know how you feel you could strengthen this report, and so that there's no restrictions. There's nothing worse than feeling like you're being forced into a framework that doesn't really allow you to provide what you think will be meaningful. And so I know I've got 43 seconds left, so real quick. The other thing I would just say is that on It was page 9 in section 9 where we talked about welcoming environment. I would just ask that, Dr. Duran, you and the team that works on this, could we please expand our description of what we're doing about a welcoming environment? Everything in a good way was about, we were talking about being culturally responsive and a focus on equity, but our welcoming environment is for everybody, and there's a lot to do with welcoming environment beyond just cultural responsiveness and equity pieces. And I want to make sure that we capture up that we recognize there's a lot of things about welcoming environment, including our special education community, how they feel. And so I just didn't feel like we were capturing that in the report as well.
I do want you to know, this process for us has had staff, we've had a lot of back and forth. I mean, to be honest, if you got, you have plenty of meetings already, but we have our own meetings. We have, just like you guys do the back and forth, we do the back and forth. So we've got some ideas, and I appreciate that chance to really come back and say, look, we've learned through this process what we think really has worked with this plan, where are some areas. So you've given us some feedback, we have our own, and I'm hopeful that we will schedule really soon. I want to schedule in January, February, early, to give staff feedback so we have all the time to get it right for next fall's formatting results. And I believe, having talked to the chair and vice chair, that there's going to be support for doing that. And it's fresh in everyone's minds, right? We've already gone through all 4 reports. We hear the indicators, make tweaks, some format ideas, and then we go back and have 6 months to work on it and then report back.
Right. And we do have, right after the budget gets passed in the first week of February, the board then is in a little bit of a waiting period. So I think that's a great timing.
And Ms. McLaughlin, I want to appreciate your comments, because around the BIMS, the behavior management system, that was something we remember we talked about when we had our discipline study. And it was actually one of the recommendations we had left from our consultants to the board, was to have a disproportionality monitoring report as part of Goal 2, and not just look at referrals by itself. And so we have been talking about that, and we welcome that, and we definitely look forward to bringing those recommendations back, because we do think that that is missing. And I will say, from the staff and the team who put this together, there were many times we said that we wish this could be a part of it, but we were sticking to what the metrics were, and we were putting that information in there, and that there were many things that we can bring to you very quickly, because we, as Dr. Rayburn said, had those conversations about other ways that we thought would be better to represent this data. However, just in full transparency, we were sticking to the metrics as they were.
I appreciate that, but as a result, we rely on you all to, if you think that's going on, alert the chair and vice chair, because I don't want you basically creating a report that you don't even recognize as being our best work, if that makes sense.
Yep.
Okay, so I think we're winding up here. We've got a couple people. I've got Ms. Schultz, and then a real quick one from Ms. Corbett Sanders. Is there anyone else that wants another go back? Okay.
Okay, if we can go back to the graph, the page 6, or wherever the homework and sleep one was. Don't we running that 3 minutes on me? Okay, so Dr. Brabrand, if you take 30.1% and 35.7%, although I don't know the N and I don't know the statistical significance of those numbers, 32.9%, a third of your high school students are doing 3 or more hours of homework a night. Yep. Want to know why they're stressed? Bam. Holidays, everybody is talking about all of this support for Indigenous Peoples Day. Where's the public engagement? Where is the public engagement? You need to do public engagement. You need to ask the public if this is what they want, instead of marching down because some people said something in 2004 and 2005. Cognito, I saw it up there as mandatory for health. I would not make anything that is a mental health support mandatory in health. You want to make it mandatory, make it optional, or put it in FLE and then allow parents to opt out. But I would not get into mandatory services. And I hate to do this, you're not going to like it. How old were you the first time you had sexual intercourse the first time? During your life, with how many people have you had sexual intercourse, with choices up to 6 or more? Did you drink alcohol or use drugs before you had sexual intercourse the last time? The last time you had sexual intercourse, did you and your partner use a condom? The last time you had sexual intercourse, what method did you and your partner use to prevent pregnancy? This goes on for question after question after question. We're asking children in 8th grade. But we're also asking them, how many times did you drink fruit juice? How many times did you eat carrots? How many times did you eat potatoes? How many times did you recycle? This is the invasive nature. I don't think we need to ask them, the last time you had sex, was it oral sex? It is the way in which these questions are posed that presume and put ideas in children's heads 110 times and 174 questions that we take academic time during the school day and ask these questions. Do we really need to be asking these type of questions? It's one thing to get information to help us make good decisions, but when 20% of your answers are yes, yes, no, and no, the statistical validity of even having those questions posed and the way that they're posed is something that we really, whether or not we decided at some point in the past, because some people asked something on FLECAC where we don't even have any representation of any faith tradition that is a nationally understood to be faith tradition. There's nobody from any Christian denomination, no Catholics, no Jewish presentation, faith tradition, no Muslims, no one, no Hindu. There's no one from any major faith tradition in the United States of America. So who is on that FLECAC and who was on that FLECAC, 17 years ago, somehow informed to the point that it now is a major input to our Goal 2 report and a deciding factor in informing our instructional content.
Ms. Schultz, I think maybe we have a response
Okay.
from somebody here on staff.
I can share with you just some data. I don't know about the membership of the committee, but I will say that in 2010, 10.2% of our 8th graders reported they were engaging in oral sex. We instituted some instructional programming around human reproduction, sexual activity, working with our partners from the Health Department and the State Department of Education. Last year, in 2018, 4.2% of our 8th graders reported engaging in oral sex. I think a 6 percentage point drop is worth noting as a growth. And
Well, yeah, whether that's an actual trajectory to causality is yet to be determined.
And our adolescent pregnancy rate has decreased as well.
Thank you, Ms. Schultz. This meeting, I think I may be the first to chair a meeting that's going to have a mature audience. As disclaimer on YouTube. After tonight's discussion, I don't know, we may have hit the threshold there. But Dr. Brabrand, did you want to make any further comments? I think this is the last go back. So if not, we will.
I think I'm good. I think I'm good. I'm in a good place.
All right.
No, I don't think so. I don't think so. I don't think so right now.
I can just answer one question you asked about the end count. So it's 10,000 to 11,000 students at each grade level are answering these questions. And it varies each year, but it's within the range of 10,000 to 11,000. We will absolutely update that.
All right.
But that will answer your first question.
All right, so thank you. Can we go to next steps? I think we've, did I miss Ms. Corbett Sanders? That's right. She said she had a very short.
Just a reminder that we will put on the schedule in the early part of the spring. I think you indicated a good timing for it after we adopt the budget. where we will look at the strategic plan and the metrics with the new board. And so just wanted to remind people of that. I will also suggest that after we do our next steps, we have a question or make a decision as to whether we're going to, how we're going to approach the next agenda item, since it's now 8:24. Thank you.
All right, so let's pull up the next steps, and we can, if you've got one up there, please read it, and make sure it reflects your intended next step. All right, so 189, express school board support for the SHAC recommendation to include a question on drowsy driving on the Fairfax Youth Survey. Ms. Evans says that is exactly what she wanted. Okay, hearing no objections, we'll move on to 190. Refer the issue of establishing Indigenous Peoples Day as a step toward creating an inclusive, caring culture to the Public Engagement Committee. That's also Ms. Evans, and she says that's reflects what she desires in terms of the next step. And hearing no objections, we'll move to 191.
It's not an objection, but I just have a question. When my understanding is that this would go to the task force, the calendar.
Well, after Dahlia made her comment about PEC, and the chair made the comment about PEC, I actually changed it. So I'm good either way. We can
Well,
say.
I think if the problem is what I see is that the task force has a natural mechanism for gaining public opinion. If you send it to PEC, they're going to have to do an entirely separate process for gauging public opinion, which I don't think is necessary.
So what about with input from the, are you talking about the task force or the calendar committee? Because there are two now. We've got the calendar committee and we've got the religious observances task force.
The task force has solely been focused on religious observances. I mean, if you wanted to add to that, you could.
Calendar committee.
So then perhaps we could add to that with input from the calendar committee. So refer it to PEC and, or would you, or if the board would rather just send it to the calendar committee, I'm fine with that
My
too.
preference is send it to the calendar committee. I don't think we need to spend more time on it.
Thank you, Mr. McElveen. Okay,
Well, could we get a sense of that, if people would rather send it to PEC or to the calendar committee?
Sure, we can. Do we have support for what's written up there as drafted? If you, this reflects what you want, Ms. Evans, I believe.
I'm fine with either PEC or the calendar committee, or PEC with input from the calendar committee.
I could certainly support it as written, but
Okay.
if we wanted to have a show of hands to make sure that we've got a majority on this one, we can.
Okay.
The way it is written is that the calendar committee would be reporting to PEC. And I don't think that's the purpose of it. So I think just send it to the calendar committee.
I think so too, and why
right.
not? So why don't we refer to the calendar committee, and then they will go through their process, whatever it is.
Okay, all right, so.
The calendar committee doesn't report to PEC. It reports to the superintendent, who gives us a calendar.
No,
All
but
right.
it actually comes to us through PEC, the calendar. The calendar comes to us
All right,
through
so let's
PEC.
start, okay, so to the calendar committee, that's fine.
Okay, and maybe a quick show of hands, those that support sending it to calendar committee. Okay, that looks like a majority. All right, great. 191, Ms. Corbett Sanders, does that reflect what you were hoping to have up there?
I would say develop a plan for communicating the availability of our social emotional help tools to our student body and to their parents. It's not only to the student body, but to their parents as well. Not some, yeah.
Okay, does anyone have any objections to 191 as written? Okay, 192, I think, I think the only change I would say to this is it's post-survey reaction. I think maybe that's fine. I mean, gather post-survey reactions of students. I don't know that it has to be every student, but I think that the way that's written is fine. Number 193, more detail on the third bullet on page 21 of the report. Ms. McLaughlin, does that, okay. 194, expand description about what we are doing to provide a welcoming environment on page 9 of the report.
Expand the description, it was, to add additional information about what we're doing.
Beyond just cultural
Beyond just
responsiveness.
cultural responsiveness and equity, yeah.
Okay. And then 195, Ms. Schultz provide the end data for student statistics on sleep and homework in the table in response 11.
N is the, so it's the percentage of
count.
what? What are the individual numbers and then the total numbers?
Okay, I think staff understands that
Yes.
request. Are there any other next steps that are missed, Ms. McLaughlin?
Yes, I had a couple. I wanted the breakout data for the student subgroups regarding the varying numbers of sleep that they had reported. So it was noted that, by the hours.
That's also on the table in response 11, right? Have it broken down beyond 8 hours? Yeah.
And then my next step was have the superintendent consider adding the BHMS data for future Goal 2 reports. I just want that noted for your consideration. The future Goal 2 report. Yeah, the Goal 2 report. And then I would like to, we didn't get a chance to talk about it, but I would like, Scott, to have you and staff maybe provide a little more contextual information and recommendations about the costs associated with the EAP program. I think we spent over $450,000. I'd like to actually know if you think that's going forward, what we want to continue doing, or if there's the contract costs. I think I'd like to understand how that compares with the industry for what we do. That's all I have now.
Are there any other entrants to the next steps from any board members? All right, hearing none, I think that concludes this portion of our work session for today. Ms. Corbett Sanders, our chair, has said we want to have a quick discussion on how to proceed with the next matter on the work session agenda, which is actually going to be run by Ms. Evans, but it has to do with the governance committee.
Okay. We ended up starting a bit late, and so because of 90 minutes because of an unforeseen matter that we had to discuss. The governance committee has spent an extensive amount of time going through and editing the governance manual. Some of it is wordsmithing, but a lot of it is substantive changes. And, correcting grammar and things that you did. That I don't think needs the detailed attention, but some of the other changes in here are things that are worthy of a discussion. I am going to put it out to the board. We can either postpone this conversation or spend an hour and have a drop of a fixed time, and then we will reschedule the remainder of this discussion to a later date. So I leave that up to, and if we can only spend about a quick, everybody weigh in 15 seconds or 30 seconds on where they're at, on how much time they have tonight versus rescheduling.
Right.
And I'll start with Ms. Hines.
Sorry. I just think we also have the PEC on our agenda for tonight, don't we, as well?
I think it was incorporated into.
Oh, it's incorporated in, all right.
That will take
Well,
quite a bit.
yeah, that's what I'm thinking. I mean, citizen input, any changes to strategic governance. I think this is going to require more time than we have and more lively attention than we are likely to give it tonight. So I would rather, unless these are time sensitive, and I know people spend a lot of time on this stuff, I know it, because I was in PEC for a year when we were working on this stuff. But I still feel like they deserve better attention than we can give them tonight if we're willing to postpone.
I second that motion.
I fourth that.